So next on the program, we have somebody that I really don't think needs an introduction, but just so that we're not playing favorites and being fair, Dr. Angela Chung, she is our next speaker, and she is a professor in the KY and Betty Ho Chair in Integrative Medicine at the University of Toronto and is a senior physician scientist at the University Health Network. She finished her MD degree at Johns Hopkins University and her PhD at Harvard University. She's held many awards, including CIHR Mid-Career and Senior Investigator Awards, the honors from the Canadian Society of Internal Medicine, the David Sackett Senior Investigation Award, amongst many, many, many other accolades. I don't know how Angela does it. She has so much involvement in many different areas of medicine, and she most relevantly for our conference is the leader of Long COVID Web, the leader of the RECLAIM National Randomized Controlled Treatment Trial for Long COVID. So I can go on and on and on, but that's going to eat up all the time. So without further ado, Angela.
I'm going to use one of these mics because I am vertically challenged, so I am going to use this instead. So I come from Toronto, where the trees meet the water, covered by Treaty 13 with the Mississaugas of the Credit. And now is really home to many diverse First Nations, Inuit, and Métis peoples. And I'm grateful to be living and working there for the last 33 years. And if you count that I was away for school and training, it's actually 36 years. So welcome everyone. It's really good to see everyone. And I actually want to respond to the person who just made the last comment saying that, you know, we hear you. And actually many of my colleagues and myself are affected with long COVID as well. And so we're passionate about doing what we do. And, you know, we understand the struggles. And so we want to work with you and everyone else to find solutions. So let me start by sharing what I like. So I really like to see things grow. And I take a lot of joy when I see the fruits of our labor. And so these are heritage tomatoes, and I brought some with me. Yes, all the way from Toronto. And you can see that, you know, these tiny little fruits is not always easy sailing. It's actually sometimes going through rainstorms and thunderstorms and lightning, and I lose some as well. But it's really a joy to see the fruits of labor, and especially when they are diverse, when they're different sizes, different colors. And when I was, you know, harvesting on Tuesday night, thinking of bringing some to some people that I'm really grateful for the partnership, it actually occurred to me, this is kind of like Long COVID Web. And Lorraine said this earlier that, you know, last year we were basically flying an airplane as we're building it. So nothing is perfect. And so we do hear feedback and other things. And, you know, we hope to sort of, you know, there's a diversity of expertise and, where people are coming from in life experiences and geographically and everything. And so we sort of, you know, everyone is very passionate about what we do. And so, you know, like it takes work to try to work together. But I'm happy to sort of use the next 10 minutes or so to show you some of the fruits of our labor. So we're actually over 1,000 registered members with Long COVID Web right now. And you can see there are researchers, clinicians, their family of long COVID patients, and their patients themselves. And about half of these are actually patients and families. And then we also have, policymakers and decision makers, patient partners, community partners, and also trainees. So I met several. Thanks for coming up and saying hi during this conference. And so, what I'm really happy about is actually, if you look across Canada, we missed 2 out of the 13 provinces and territories. So this is for next year. We're hoping to get people from Northwest Territory and Nunavut. And you can see that, Ontario being the most populous province has the highest, but Alberta, BC, Quebec has many people as well. And if we look at the communities or populations experiencing inequities, so we have more women than men. We have a small percentage of the non-traditional sort of gender roles. We have 14% visible minority and 3% Indigenous. And if you break it down by pillars, so we have 4 pillars. The biomedical pillar, which has outstanding presentations in that back room there. The clinical pillar, the health services research pillar, and population health pillars. You can see that it's quite evenly distributed. And someone said yesterday that they didn't know that they can join any pillar. For sure, join any pillar, and you'll get the emails from the pillar. So welcome you to do that. And so if you haven't registered, and I'm encouraging all the trainees as well, please register at Long COVID Web. It's free. You just have to abide by the code of conduct. So there's you can scan that, the membership registration. But what tells us a little bit more is actually the demographic and EDI, Equity, Diversity, and Inclusion Survey. So if you can fill that one out as well, we would appreciate it. So I'm going to give you a bit of a year in review. So we started the year in January being very reflective, looking at sort of what has gone well, what hasn't gone well. And Maxi, Mysiak, and Susan Law over there in that corner. Do you want to stand? Yeah, both of you. Dr. Law and Dr. Mysiak, thank you very much for sort of joining forces and sort of putting this sort of year in review out. And really went over sort of what we did last year, and it's on the web, so you don't have to sort of look right now, but you can take a look later. And it sort of summarizes publications, media appearances, presentations, and funding. And you can see that we got some funding in terms of the network, about 339,000. But what I really want to share with you is really the lessons learned. So I don't want to tell you sort of what great things happened. You sort of can see through the website and other things. But I want to share with you sort of what we learned. We learned that we were not doing so well in Indigenous engagement, even though we put quite a bit of effort into that. We learned that we really need research in diversified populations, the EDIA piece, and pediatric populations, as well as sort of looking at population and economic impact, especially workforce, especially sort of back to work, return to work issues. And when we looked at sort of like, we have a patient council, advisory council, it's like 10 people or so. And we were really working them hard. And it's really hard to do a lot of things, and we have to sort of, want not people to burn out either. And so it came as one of the pieces of feedback and stuff that we need to somehow make use of our 540-something other patients to partner. And so sort of need to spread things a bit. And then the last piece was knowledge mobilization. So great, all the things that you're doing, if you are only sort of like people joining at a conference and going to sessions, you know what's going on. But you may not know what's going on if you are only sort of an outsider. And so it's really important for us to work on knowledge mobilization. So that's January 2023. We also learned that it's a big network. How can we refine and streamline data collection and validation processes for improved accuracy and efficiency? And the whole operations team is involved in this as well. And then impact analysis is really led by Maxi, who you saw earlier, and how we can refine our framework for impact and develop high-level questions, reviewing potential indicators, and exploring assessment methods. And I would say that our funding agencies are really looking to us and for guidance on that. And it's also other research networks as well, looking to us for guidance on impact assessment. Because we're spending taxpayers' money, so we want to make sure that every dollar is sort of, cost effective. Then in March, we wrote a whole bunch of support letters for 24 applications, and 10 were successfully funded. And so for researchers within the long COVID web as a group, got more than 13 million. And I just heard Doug Fraser shared that he got another 8 million, not from CIHR, but from other sources. I want to highlight a few to you. So you heard about the project that Gavin and Lawrence are spearheading on the taurine piece. And that, yes, we're not mice or hamsters. We're people, so whether it works in people with a supplement or not, well, I think you really need to go through clinical trials. And I want to highlight the ICANN CME as well network. We supported their reapplication, and they got 2 million for 5 years. And then the last one that I want to highlight is the project that Naveed Janjua from BC is leading, called the Multi-Provincial Surveillance Systems for Post-COVID Condition and Outcomes. And this was jointly funded by the Public Health Agency of Canada and also the Michael Smith Health Research Foundation in BC. And so for a total of 1.4 million. So congratulations to everyone for those successes. Then in June, we had an international advisory board meeting with Akiko Iwasaki and Syed Al-Ali from the US, Young Chung from South Korea, and Roger Paradis from Spain, and Peter Uni from the UK. And so again, they thought we were doing well, but I like to look at where we can improve. And so they mentioned some challenges in general. So internationally, it's not just with us per se. Engagement with decision makers, collaborating with WHO, evaluate economic impact, sharing data and results internationally, focus on pediatric population, and repurposing medications for treatment. So those were their advice. And there were 3 that were sort of more for us, learning from global efforts, partner with other countries, and invest in large trials. And we did partner with other countries. We partner with US and Spain to put out the Demystifying Long COVID North American meeting. So there's a European meeting coming up in November. You can Google on the internet. But this one, I had the pleasure, together with Anne Burrell, who is the family physician and a long COVID sufferer as well, to actually make sure that Canadian science and Canada is well represented. So we actually have Sarah Vback from Public Health Agency to talk about epidemiology and long COVID prevalence. I talked about the challenges in providing care for adult population and rehabilitation. Doug actually talked about vascular dysfunction. And Kieran talked about causal inference and using electronic health record and longitudinal analysis in long COVID. And then finally, I shared about the RECLAIM adaptive platform trial. We have very regular partners meetings with PHAC, the Public Health Agency, the Chief Science Advisor's Office, the Center for Research on Pandemic Preparedness and Health Emergencies at CIHR, and also Health Canada. And more importantly, we also have very regular meetings with CAN-PCC, so that's the Canadian Guidelines for Post-COVID Condition, or for Long COVID. And Dr. Robbie Newlat is actually here in our midst and presenting a couple of posters as well. So please go and chat with him, be respectful. The processes with the guidelines are actually done separately from Long COVID Web, but many of our patients, many of our clinicians and researchers are participating in that process as well. And then we actually have webinars, which started since October, led by Dr. Susan Law sitting there. And the sessions are recorded and posted online, and slides are posted too, if the speaker permits. And there's a wide range of topics. So this is where, if you want some science, this is where you go. Around organization of care, around biomarkers and phenotyping, long COVID in children, the UK REACT long COVID study, prevention and vaccines. And last month, Syed Al-Ali actually gave the epidemiology talk as well. We actually have a very diverse audience, ranging from patients to clinicians to researchers to health decision makers. And I would say each session has about 80 to more than 220 attendees. And the online material is viewed like 100 to 350 times. And so at each of these sessions, we ask for feedback. What is useful to you? What are the relevant topics? What you would like to hear, and suggestions for speaker and topics. So I do welcome all of you to sort of like send us an email saying, I would love to hear this person, and we can certainly try. The other piece is that, many of you, we heard, is that we actually want to be the one-stop shop for trusted resources. And again, the team has been working on this. It's a collaboration between the Patient Advisory Council and also the scientists and clinicians. It's evidence-based and curated. It's not includes everything per se that's out there. It's already quite long, it's 11 pages. And you can see the sections, fact sheets, guidance for healthcare professionals, finding support and getting help, and reading materials, and how to get involved in research. It's updated regularly and reviewed, and we are collaborating with CAN-PCC on resources. So do check it out, give us feedback, and we can move from there. And finally, you're all here for this conference, and have to thank really Doug and Grace and the whole organization team for working hard on this for the last year. This is an amazing venue and amazing sort of speaker list and other things, and all the arrangements as well. So thank you. We had 70 submissions of abstracts, 66 were accepted, and 36 are presented here in person. And everything you can find on the web as well. And I'm so happy to see sort of the artwork. I think Doug is right, like it really frames our conference, and I would love to see more of that. And they're really beautiful. And I want to thank the sponsors for this. This is an accredited conference. Okay, people are always asking me, what about, funding? Well, we gave out 2.1 million last year, and we're able to bring in-kind support, either external support or in-kind support as well, you can see there. So the team that's led by Chester, Chester, are you here? I want to thank you, if you can stand, and all the reviewers as well. They have been doing a lot of work. Can you stand? We just want to say thank you. Patient reviewers as well, so can you stand? Okay. Some people are shy, I can see, yeah. So they're working hard, and hopefully over the next few weeks to a month, there will be some results for this round of funding. Now, we heard you loud and clear in terms of physicians don't know anything. We learned from our patients. So this is the ECHO project. It's Enhancing Community Health Outcomes. And there's going to be a French one that's being launched November, December, and there's an English one that's being launched January. And it's establishing a community of practice so that they can learn from each other. So it's for family physicians, specialists, nurse practitioners, physician assistants, rehab professionals, and other health professionals. And it's set up such that there are short didactic sessions, like 20 minutes, to give up-to-date updates. And then it's case discussions. People submit cases and discuss. And so in Quebec, it's partnered with Ministry of Health. And so we thank you for that partnership for the next 3 years. This is my loss, so I know Doug is holding up the 1-minute sign. I'm really thankful to see all these little fruits from everywhere, and we are definitely making progress. This is faster than HIV. So I lived through the HIV the initial stages. It's not perfect. We don't have all the answers. We don't have a proven biomarker. We don't have a proven treatment, but we all have the same goal. We're coming together to find solutions and try to understand this more. So for those of you who are online, I'm sorry I don't have virtual tomatoes to share with you, but for those who are here, I do have some tomatoes to share with you. And with that, thank you.